Why is a 3-month-old baby suddenly having difficulty falling back to sleep when they were previously sleeping between 10 to 12 hours overnight? This is one of the most common ages that exhausted parents reach out to me as a sleep consultant to help get their babies sleeping well, because all of a sudden things start to change. If you haven't heard about it already, this is commonly when the 4-month sleep regression will happen. The 4-month progression will commonly happen anywhere between 3 to 5 months, but it can start to happen as early as 8 weeks. When babies go through the 4-month sleep regression, that's when their sleep patterns start to change. And ultimately what that means is that they stop sleeping like a newborn and they start sleeping like we do as adults. So rather than just having 2 stages of sleep, which is quiet sleep and active sleep as a newborn, they now have 4 defined stages. These stages are REM and non-REM sleep, and they make up a full sleep cycle. So once they go through a full sleep cycle, at the end of that sleep cycle, they have the ability for a partial waking or a full wake up. If they have a full waking, they will wake up completely. Whereas if they have a partial waking, they may stir a bit and then fall back to sleep and start a new sleep cycle. A very typical sign of what this actually looks like is 30 to 45 minutes naps during the day and waking up usually sometime between every 1 to 2 hours overnight, and you may feel like these wakes are like clockwork. What that means is that when your little one goes through a sleep cycle, however they fell asleep in the first instance at the beginning of that sleep, so if they were rocked to sleep, fed to sleep, patted to sleep, shushed to sleep, or co-sleeping, once they wake up after that sleep cycle, they usually need that same thing to fall back to sleep. So that's when you get people like me, a pediatric sleep consultant, talk about self-settling. If you're having issues with this, your little one will likely need to learn how to put themselves back to sleep without you doing it for them. All babies will respond to the 4-month sleep regression differently. Some babies will breeze completely through it and you actually won't notice any changes. Whereas for others, they really struggle with it. And there are families that I've worked with that have never actually recovered from the 4-month sleep regression. These are babies that are 6, 7, 8, 9, 10 months and older who continue to take short naps and wake every 1 to 2 hours overnight because they have a strong sleep association that they need to fall asleep. That's why I designed our 3 to 4 month mini program. It's only 40 minutes long and it's deliberately designed for babies going through the 4-month sleep regression, where we lay down your little one's sleep foundations and we really gently and slowly start working on their self-settling skills. There's no cry it out, it's not appropriate for this age. And the settling techniques are specifically for 3 and 4-month-old babies only. So if you need that extra help and you're really wanting to start gently working on your little one's self-settling skills, if you click on my photo, it will take you to the 3 to 4 month mini program and you can access that and start it straight away. Share this video with another mum that you think it would really help. For more baby and toddler sleep tips, make sure you follow for more.